I'd like to look at cardiovascular disease in a different way tonight, in a way that I think can help us clarify some of the issues of cardiovascular disease and to help organize our present modalities, practice modalities, into an organized, unified concept. So what I suggest is that cardiovascular disease is a chronic degenerative disease. It's an immune system disorder caused by inflammation. The lymphatics play a major role in the clearance of pro-inflammatory substances and the exit of high-density lipoproteins, as well as the migration of the macrophages and dendritic cells, is dependent on the lymphatic system. Well, many moons ago, I was very fortunate to have been trained with two of the giants of the cardiovascular world, Drs. DeBakey and Dr. Cooley. And it was a very exciting time. We did the first 6 successful heart transplants, and we were really flying high. We thought we were walking on the moon like the astronauts, and we were in the cutting edge of cardiovascular surgery. And then within a short period of time, within a year or two, all these patients died. And the disease of many of them was galloping atherosclerosis. That was what it was called. And couldn't figure out, these were healthy hearts with clean vessels, and in a short period of time, they were 90-year-old arteries. And this was not only a professional failure, but a personal loss, because these people were acquaintances and friends. Louis Fierro was a fellow from New York who he liked the Mets, and when the Mets came to town to play the Astros, we both went to the ball game together. So it was, as I say, it was a personal loss and a professional failure. And it always kept in the back of my mind. And so when I left Houston, I was made chief of cardiac surgery at Temple University. And one of my colleagues, Betty Lausch, was in the Department of Pathology. She said, well, we should think about the possibility that the clearance, caused this, poor clearance caused the atherosclerosis. So we did 4 rhesus monkeys. I ligated them, and sure enough, within a short period of time, they did develop atherosclerosis. So I thought, well, if that can happen in the acute stage, that you can ligate and tie it off, maybe in chronic settings where the lymphatic flow is low or sclerosed or constricted, maybe over time in the usual sense, perhaps that can cause atherosclerosis in the ordinary way. But it was a bit of a reach because, as you can see, the disease occurs in the endothelium and the intima, and the lymphatics from the adventitia go into the middle third of the media. So the cholesterol have to go a long way to get there. But the other thing is the lymphatics were like a secret river, mysterious circulatory system. Very little research then and even now on the lymphatic systems. But it's interesting because it was necessary for life. It was essential for fluid exchange, for protein exchange. It was the immune domain and necessary for lipid and fatty acid transport. What affected the lymphatic flow was the fluidity and viscosity of the lymph, the muscle action of the skeletal muscles pumping the lymph, peristalsis, contraction, dilatation, the pressure gradient across the lymphatic channels, and sclerosis or scarring of the lymph. The lymph fluid itself can be very watery or viscous, almost like a gel, and that depends on the hydration and the compounds that would affect it passing through it. We knew that all the lymph fluid passed through the thoracic chamber in the thoracic duct, and this was greatly dependent on the negative interthoracic pressure and the milking and pressure and massaging of the diaphragm, both diaphragms. And indeed, some people report that you could increase the lymphatic flow in the thoracic duct by 15-fold by vigorous movement to the diaphragm. And we had certain clues that maybe hinted to this postulation. that we knew that, that it occurred only in the large and medium-sized vessels. We knew that it occurred in the epicardial artery only unless there was cardiomyopathy. Then you could see it actually dipping into the muscle. We knew that the lymphatic sclerosis was in the arterial disease, and there was a poor correlation with cholesterol level and heart disease. We know that shallow breathing and sitting can increase cardiac disease, and it occurred in unmuscled areas like the neck or the groin. Now, there are factors in atherosclerosis. There are beneficial factors and harmful factors, but they don't seem to jive up. They are disparate. The harmful factors, as we all know, are smoking, obesity, hypertension, lack of exercise, diabetes, poor diet, stress, CRP, homocysteine, cholesterol, infection, trans and saturated fats, and other things. And the beneficial ones are exercise, good diet, vegetables, stress modifiers, deep breathing, omega-3s, massage, meditation, yoga, positive attitude, prayer, green tea, and other things. The only way you could correlate all these good things is through a lymphatic linkage between the heart and the immune system. So over the 6 or 7 years that pursued, we got real busy. We were doing about 1,500, up to 1,500 open hearts a year, and the laboratory research kind of faded away. That usually happens when you get busy. So, but it always is in the back of my mind, and I noticed that with patients who were doing coronary bypasses on, there were sclerotic lymph vessels along the epicardium. You can see it right there. And we knew and we saw that in the 70s and or 80s, this was not known, but it's pretty well known now, but we knew that you could get cardiac disease, coronary disease from radiation, and that it caused lymphosclerosis. Smoking causes lymphatic sclerosis and constriction. So in 1981, I wrote an editorial in the Annals of Thoracic Surgery that postulated that the critical factor in the genesis of arteriosclerosis is lymphostasis, which adequately explains the positive correlation with the known risk factors for coronary disease and the negative correlation for high-density lipoproteins. So let's posit a supposition. Let's imagine that here we are which we are, on the Avenue of the Americas, and the Avenue of the Americas is our arterial flow. And it's one way up, and down here is the lymphatic flow on Fifth Avenue. So the cabs come up, pick up a passenger, come up, drop them off, and then go back, and then over again to pick up more passengers. Now, if you have an accident or traffic jams on Fifth Avenue, you're going to get a lot of cabs there, and only a few cabs coming through the Avenue of the Americas. Now, the customers waiting on those corners, especially if it's raining, are going to be pretty angry, and they're going to be inflamed. And we know that inflammation is the heart of the matter when it comes to arteriosclerosis. So what is that about? Inflammation is not a bad thing. It's a good thing. It's the body's protective response to toxins, pathogens, irritants, trauma, free radicals, etc. So when you think about the circus and the fire eater, he never got himself burned. He never burned his tongue. Nothing ever happened. Why was that? Well, he didn't keep the flame long enough in contact with the tissue to damage it. And the same thing is true with the oxidized cholesterol. If it's carried away fast enough, it's not going to cause tissue damage. So what happens is if you have an irritation or a pro-inflammatory toxin in the wall, you get a local paracrine-autocrine reaction, local inflammation, and then messages are sent through the lymphatics to the immune system, the nervous system, and to the endocrine system, the liver, the fat adipose tissue, and the adrenals, and they all respond in a general inflammatory way until that irritant is cleaned up. When it is, or if it isn't, when it is cleaned up, messages will be sent and cells will be sent through the immune system to say to the nervous system and the endocrine system, hey, everything's fine, let's shut it off. And you'll get, for example, M2 macrophages rather than M1, so there'll be a healing, a pro-resolution situation set up. Well, if that messages get delayed or don't get through there, you're going to have a prolonged chronic inflammatory reaction. This is the next is a video from the Cleveland Clinic, which shows how HDL, which we all think is, you know, a good thing, can actually be paralyzed by certain things. One in this example is myeloperoxidase, but
HDL is a protein that helps prevent narrowing or clogged arteries by acting like a garbage truck. It picks up the bad cholesterol and moves it out of the artery for disposal. But Cleveland Clinic researchers found an enzyme in the blood called myeloperoxidase makes HDL dysfunctional. And this dysfunction prevents HDL from doing its job and increases the risk of plaque buildup.
Now, that's a very good example of the discoid thin HDL and how it takes cholesterol from the macrophage. But recent evidence suggests that this flight and exit of the HDL, the large full of cholesterol HDL, does not go into the arterial system. It doesn't stand to reason that it does, because it's against the hydrostatic gradient. And in fact, it's not a living cell that could move around. It's a particle. So the recent evidence suggests that this goes through the arterial wall, along with the macrophages and dendritic cells, to go into the lymphatics and then be processed into the liver that way. A better picture is this picture from the New England Journal of 2011, Gersten and Tager, who show the picture of the macrophage coming through the endothelium, picking up cholesterol, and then exiting out the arterial wall, as does the HDL. And that's a more recent and evidence-based idea. Now, if you look at this and you think about the surface of the arterial wall, the intima, media, and adventitia, you see the three areas. And you look at the different particles, the VLDL and the bad LDL, which is the small hard particles. And these are the ones that cause problems. They stay in the circulation longer, and they're much more oxidative. And the small HDL. Well, over the years with hypertension and certain problems and situations, you'll get divots in your endothelium. And these, you're going to randomly bounce around in the arterial system, and some of them will fall in those holes. And when they're in the wrong place at the wrong time. And they become oxidized, and they become a foreign body that the macrophages have to take care of. So today we think we have these bad guys and these good guys. The bad guys and the good guys. Who are the bad guys? Well, they're cholesterol, and they're foam cells, and they're inflammation. Well, who are the good guys? Well, they're cholesterols, foam cells, and inflammation, and HDL. Because cholesterol, if the LDL went through the capillaries to nourish the cells, you get cell membranes, hormones, and vitamins created with that cholesterol. Foam cells are just doing their job. They see something there that causes tissue damage, and they're going to engulf it and try to prevent anything bad from happening. Inflammation, as we said, is a normal body's reaction. Now, HDL is the good thing, but look at what we just saw about myeloperoxidase and HDL, how it can actually slow down the progression or the care of the cholesterol. So when this young woman is busy doing her exercise and she comes in all sweaty and takes a quick drink of water and it goes down the wrong windpipe, wrong way, and she coughs it up, that's not bad water. That's in the wrong place. And when this chap removes the gasoline from his gas tank and it drips on his paint, and he doesn't wash it off, and it happens several times, he's going to lose the paint job on his car. That's not bad gasoline, it's in the wrong place. And the same thing with the LDL. It's not bad LDL, it's just LDL that's in the wrong place. So thinking of it this way and using the lymphatic system enables us then to have a unifying concept of arteriosclerosis. So we have initiating agents. We have the vessel wall that always tries to get homeostasis, and we have clearance through the lymphatics. The initiating agents can be oxidized cholesterol. It can be actually, it can be ApoB. It doesn't have to have LDL there. It can be homocysteine or bacterial infection, sugar, Helicobacter, chlamydia, cytomegalic. And so the body's reserve, or what it has to protect itself for oxidative reactive oxygen species, is antioxidants. In fact, vitamin D, there was a recent article, I don't have it here, which shows that vitamin D helps with cholesterol in that it prevents the ingress of dendritic cells and macrophages into the endothelium. So it's helpful there. And certainly essential fatty acids and minerals, antibiotics, etc. And then neuropeptides and immunopeptides regulate the flow of these inflammatory toxins across the arterial wall into the lymphatic system, and this flow is enhanced by massage, exercise, deep breathing, meditation, yoga, lymphagogues, herbal tea, and a positive attitude. So we have now an overarching principle which we can tie in to the present modalities you're doing. We can explain how the good things you suggest and recommend for your patients can actually be translated back to reducing arteriosclerosis. And then in the 80s, there were some papers, a lot of them from overseas, that showed that, for example, there were more small HDL particles in the serum than there were in the lymphatic fluids, which meant that the big HDL, which was filled with the cholesterol from going through the wall, was more in the lymphatic system than the serum, which suggested that this route was what was happening. Then from Denmark in '90, there was a Nordisgaard showed that as much as 95% of the HDL that went through the intimer, that entered the intimer, penetrated the elastic lamina, and that most of the efflux route for HDL cholesterol was through the lymphatics and vasa vasorum. Then another one from Russia said that lymphstasis and lymphogenic sclerosis represented essential factors in the progression of heart disease. So how does this apply to our wellness tripod of stress modification, exercise and detoxification, and diet and supplements if needed? Well, stress is a psychological issue, but it has a physical effect on us that can work through the lymphatics because it increases inflammation, suppresses the immune system, and causes sleep deprivation. We know that men with the highest levels of urinary cortisol in times of anxiety, worry, and stress have the highest incidence of coronary heart disease. Certain negative emotions like fear, depression, anger can all cause lymphatic stasis and lead to cardiac problems. What does stress modification do? Well, it lowers the cortisol and epinephrine, lowers the glucose, lowers free radical formation, increases endorphins. So what are some of the modalities to decrease stress? Massage. Well, what does massage do? It's a fantastic lymph movement methodology. They used to, years ago, they used to cannulate dogs to measure the lymphatic flow. And when things were slowing down, all they do is massage the dog's neck, and they just increase the flow exponentially. Yoga is called the internal organ massage. And yoga has become very, very popular in our society today. Everybody is doing it. Everybody. So these are important things that have a correlation with the lymphatic system: meditation, connectedness, affection, prayer. And what about exercise? Exercise can increase your lymphatic flow by 7-fold. Now, the average metabolic life of an HDL particle is about 4 days. Macrophages live weeks to maybe a month. The average circulation time for lipids and proteins in the body is about 2 days. So if you increase it by 7-fold, you can actually increase the circulation think of all the amount of cholesterol that HDL can pick up as if you didn't have any exercise. But everybody isn't quite honest. Well, not honest. Let's say everybody isn't quite accurate about their exercise amounts. So this guy is asking his patient, be honest, how much are you exercising? And trampoline's a wonderful form of exercise. It really gets the lymph going because we have one-way valves, and once the lymph goes up, it stays up, gets your heart rate going real fast, and it's a wonderful form of exercise. And once again, I think it's a family affair. I think everybody in the household should do it. He loves it. And if you have a job where you have to sit a lot, make sure that you get up every hour or so and walk around, get that lymph flowing, because your sedentary position for long periods of time is not helpful. Now, with diet, you don't want to be a couch cat and eat some trans fats and Frito-Lays and diet soda. And Daflon is an interesting, and I bring this up because it's a medication from France. It's been around for about 30 years. And it's for hemorrhoids, varicose veins, and lymphedema. Daflon improves lymphatic drainage by increasing the frequency and intensity of the contractions. It reduces the expression of adhesion molecules and selectin. It inhibits adhesion migration and activation. It leads to the reduction of release of inflammatory mediators, principally oxygen-free radicals and prostaglandins PGE2 and PGF2. You wonder why you wouldn't use this. If you believed in the lymphatics thing, why wouldn't you use this in arterial problems rather than just the venous problems? The reason I bring this up is because Daflon is essentially hesperidin and a semi-synthetic hesperidin called diosmin. Both of these are flavonoids. And quercetin is another flavonoid, which is also a lymphagogue and has a very powerful antioxidant benefits. So you can get these from your vegetables, your colored vegetables and your fruits. And there are many phytonutrients in your fruits and vegetables, and they all have lymphagogic benefit. So I would impress you, and this is one of the reasons why I think that these things are helpful. These foods are helpful because they get the lymphatic flow to continue. And certainly, other vegetables like beans and grains, soluble fiber or insoluble fiber. Spices are good lymphagogues, so turmeric and ginger. And this boy is not knocked out by it. He says, how come they don't have mad cauliflower disease? So what's a good diet in this case? Well, certainly plant-based, crucifers like broccoli, kale, etc., cauliflower, high fiber, turmeric, cayenne, garlic, mushrooms, berries, green tea, pure water, fermented soya, olive oil. A diet at high complex, maybe 60% carbohydrate, vegetables, fruit, and nuts and grains. Good fats, 20%, good fats, and 20% protein. Minimize meats, dairy products, and fish. Avoid refined carbohydrates. Incorporate high fiber and supplements if you're deficient in them. And you really have to get tested for that if that's the case. You want to avoid dairy products, processed meat, trans fats, excess fat, sugar, white flour, omega-6s, and artificial coloring. Of course, the xenoestrogens and endocrine disruptors that are in the POPs and the pesticides and PCB and dioxin. And we all know about these things, so we want to stay away from them. Michael Pollan said, eat real food, not much, mostly vegetables. And that's probably the best advice I could give. Eat real food, not much, mostly vegetables. Michael Pollan, as you all know, is a wonderful author and journalist who got a job as professor at Stanford, was it? So, Berkeley, for his wonderful coverage of diet. So back again to this picture from the New England Journal from Harvard, Gersten and Tager. What's interesting in the last 5 or 6 years, what they've seen is this potential for being an autoimmune disease. They haven't had antibodies for it or identified a T cell that they can identify as the agent, but it certainly is cholesterol is something that's manufactured by the body, and the reaction is against that, and there's an immune reaction. But what they did notice, and what's interesting is, they noticed in the young Park, who from the Cleveland Clinic, and Van Gils and some other people noticed that you can actually have foam cells migrate with the cholesterol in place, and they're suggesting that the migration of the macrophages may be as important as the HDL going through the arterial wall too. And what happens is certain chemokines and certain CD36 using oxidized LDL can create a reactive oxygen species inside the cell, which then can be obviated by things like NAC and resveratrol. And actually, there's another inhibitor, an NADPH oxidase inhibitor called, it's from vanillin, and it actually comes from the root of the Canadian hemp. So there are natural things that you can get that are powerful obviators of radical oxygen species and of the slowing down of the macrophage through the wall. So what happens here is if this gets stopped, and the way it gets stopped is these reactive oxygen species change the plasticity of the macrophage, and it cannot move through there. When you remove the offending the proteins and peptides, they can once again migrate through the wall. There's a neuroimmune guidance cue called netrin, which basically blocks the macrophages by changing their plasticity. And so there are several proteins and peptides that can essentially block these macrophages and stop the HDL from moving through. And if you can get that going, it's just as significant as stopping the ingress of the monocyte to become a macrophage. So there's new evidence suggesting this. For example, from Germany, the adventitia as a site of local adaptive immune reactions during atherogenesis in hyperlipidemic mice showed that you could have an 85-fold increase in adventitial T cells in these studies. Once again, Aliska, which we said 33 years ago, that the absence of lymphatics may predispose to coronary artery disease. 2008, the resolution of inflammatory reactions involves the emigration of macrophages from the inflamed site through the nearby lymphatic vessels. This came from Mount Sinai here in New York, 2008. And the resolution is impaired in atherosclerosis. And 2013, once again in Mount Sinai, the lymphatic vessel route is critical for reverse cholesterol transport. Supporting lymphatic transport functions may facilitate cholesterol clearance. That's exactly what you're doing with the modalities that you're using. And interestingly, we talked about netrin being a neuroimmune guidance cue. There's another one, SEMA3E, which is expressed in atherosclerotic plaques, and it regulates macrophage retention. And here we are looking at guidance cues that actually guide the cells in the nervous system to make myelin sheath and for the microglia. And they are negative regulators of macrophage migration and promote macrophage retention in chronic inflammation. And there are other studies that show that neuropeptides, neuropeptide Y, neuropeptide substance P, are found in the atherosclerotic plaque. So there's a symphony of inflammatory things that are causing basically the slowing down of the macrophage to cause a super inflammatory reaction and a loss of HDL movement. So maybe we should be looking at new lab profile for heart health, measuring IL-6 or FA isoprostane, CRP, measuring indicators of immune status, CD4, CD8 ratio, or the mature T cells, or the natural killer cells, measuring the antioxidant status, vitamins, and minerals. So once again, going back to the concept, using putting all this together, you're looking at initiating agents and being counterbalanced, going through the endothelium, being counterbalanced by an attempt at homeostasis and the clearance of these pro-inflammatory substances to the lymphatics, being regulated by neuroimmunopeptides and being enhanced by massage, exercise, deep breathing, meditation, yoga, etc. So the question is, well, why would there be all this cholesterol if you had an infection in your artery? Well, the fact of the matter is the cholesterol is the most, not prolific, but the most abundant irritation that the artery wall sees. And if a bacteria causes an inflammation and the macrophages have to go and take care of that inflammation, then it's like that Lucy Ball thing with the sodas as they went down the line and they just couldn't keep up with it. The cholesterol continues coming in and becoming oxidative and an irritant, and that builds up, even though the initiating agent was an infection. So the summary, once again, as we started, was that cardiovascular disease is a chronic degenerative immune disorder caused by inflammation. The lymphatics play a major role in the clearance of oxidized cholesterol and other pro-inflammatory toxins. And the egress of high-density lipoprotein as well as macrophage and dendritic migration is dependent on the fluidity and the circulation of the lymphatic system. Thank you.